Despite a number of studies questioning the usefulness of very low-salt diets in the last few years, and not a few healthcare triage episodes, most major medical organizations continue to recommend them. We would assume that they do so from a strong base of evidence. But with respect to heart failure, there's a shockingly small amount of evidence. That's the topic of this week's healthcare triage. Heart failure occurs when the heart can't pump enough blood to the rest of the body. About 5.7 million people in the United States suffer from it. Chronic high blood pressure can force the heart to work too hard over time, weakening it and leading to heart failure. Treatment usually involves trying to strengthen the contractions of the heart muscle with drugs, or reducing the volume of blood with other drugs like diuretics, or by reducing salt intake. Recently, researchers searched for randomized controlled trials that evaluated the use of reduced sodium intake to treat heart failure. In all the literature, they found 9 studies that involved 479 patients. One of them was published only in abstract form. None involved more than 100 patients. Overall, none of them were considered at low risk for bias. There were no data that showed that salt restriction reduced mortality or cardiac disease, affected whether someone was admitted to the hospital, or influenced how long they had to stay if admitted. Of 4 outpatient studies, 2 showed no improvement in heart function and 2 did. This is a minuscule amount of data on which to base strong recommendations. An accompanying editorial written by Clyde Yancey, a professor of cardiology at Northwestern School of Medicine, noted that 0.3% of the studies that looked at sodium restriction and heart failure were of sufficient quality to be included in this systematic review. We need better research, and some of that may be on the way. The geriatric out-of-hospital randomized meal trial on heart failure randomly assigned 66 patients to home-delivered low-salt meals after hospital discharge to study how well they work. Its findings are pending. Another study, still continuing, has randomly assigned 1,000 people to usual care or a very low sodium diet, 1,500 milligrams a day, what the American Heart Association recommends for most adults, to look at outcomes related to heart failure. Until then, some will argue that there's little harm from these recommendations, so why not continue them? One reason to stop them is that there's a risk of emphasizing salt avoidance at the expense of other, potentially more useful diet measures when we really don't know what's best. For example, the Agency for Healthcare Research and Quality examined the effects of both sodium and potassium intake on health. It reported this year that lower sodium intake most likely reduces blood pressure, but it also reported that increasing potassium intake most likely has the same effect, because consuming more potassium causes you to excrete more sodium in your urine. Of course, excess potassium has its own risks, and any major dietary changes should be discussed with a physician. We are not giving you medical advice. Other systematic reviews find that an increased intake of fiber is associated with a lower risk of heart disease. It's important to note that we also lack a strong evidence base from randomized controlled trials where potassium and fiber are concerned. But recommendations for those diet changes don't seem nearly as vocal or as strident as the push for salt reduction. The larger point is that if all these lack strong evidence, we should admit it and make our advice more equivalent and appropriately less confident. Or we could push for more healthy, holistic lifestyle changes in general, while acknowledging that, yes, people who consume large amounts of sodium might benefit from cutting back. We could advise people to exercise regularly, which has an enormous evidence base, and to eat more healthfully overall. Both the DASH, or Dietary Approaches to Stop Hypertension diet, and the Mediterranean diet have been associated with lower rates of heart failure. Such diets may affect more than just salt, but they certainly would benefit from more controlled trials to prove their worth. In his editorial, Dr. Yancey writes bluntly that the evidence for sodium restriction is, and I'm quoting, vacuous, lacks depth, and in some cases lacks integrity. He adds, the first step is not a call for more trials, but a retreat from an unbridled and potentially harmful insistence on rigorous sodium restriction in those with symptomatic heart failure. Unfortunately, this exhortation could apply to more than just this one instance. Whether it's our consumption of fat or meat or sugar or even salt, it seems the assurance with which we speak should match the quality of evidence behind our recommendations. Hey, do you like the show? Helps if you like it down there or even subscribe to the show. We love that. But another good way to support the show is a subscription service called Patreon.com. Patreon allows you, the viewer, to donate any amount of money you like, even $1 a month or more if you want, it doesn't really matter, to help support the show and make it bigger and better. You can go to patreon.com/healthcaretriage. And while we've got you, great merch at HTTmerch.com, my book, The Bad Food Bible, still on sale in stores. And back to Patreon, we'd especially like to thank our research associate Joe Sevitz and, of course, our Surgeon Admiral Sam. We really appreciate the support.